Are we on? You can hear me. Okay. Thank you very much for attending the press conference. I'm honored to share the podium with my colleagues in the Republican caucus. We have the Bradford County Commissioner here. It's good to see him. We have Senator here as well. We have leadership, many chairmen. This is a very, very relevant and timely issue, very important issue. In which we've actually had in the last couple of weeks a 3.5-hour hearing conducted by the House Human Services Committee, and we also had a 2-hour hearing that I had the opportunity to chair in the Health Committee regarding the issue of Medicaid expansion. It's a very, very important issue. It has many implications and ramifications. Welcome. Come right up. President Barack Obama himself in 2009 said Medicaid is a broken system. Governor Perry of Texas said it would benefit no one in our state to see the taxes skyrocket and our economy crushed as our budget crumbled under the weight of oppressive Medicaid costs. Medicaid expansion costs in Pennsylvania are estimated to be anywhere from $4 billion to $5.8 billion. Already 1/3 of our state budget pays for Medicaid here in Pennsylvania. Overall, the budget in DPW, the Department of Public Welfare, is 40% of our entire state revenue budget. 1 in 6 people in Pennsylvania currently receive Medicaid. That's 2.2 million people in Pennsylvania currently are on Medicaid. If we expand Medicaid, it's estimated upwards to 800,000 more people will be on Medicaid, public assistance, or 1 in 4 people, 25% of our entire population would be on Medicaid in Pennsylvania if we expand, and it's 800,000 more enrollees. From 1990 to 2010, national Medicaid expenditures rose 445%, while over that span, the Medicaid caseload increased 135%. Proponents of expansion insist it's a good deal because the federal government will pick up most of the tab, insisting that this is free money. Pennsylvanians, however, know there's no such thing as free money. We know there's only money that's collected from taxpayers and money borrowed from other countries like China against the good credit of our children and grandchildren. One of the testifiers the other day in the Health Committee, Congressman Joe Pitts, who chairs a subcommittee on health in Washington, D.C., the majority chairman, said we already have a $17 trillion debt at the national level, and in fact, it continues to climb with no plan to stop the fiscal irresponsibility. Some argue we can withdraw from the expansion if or when Washington breaks its promise on funding, but experience has shown us that once in place, these types of entitlements are extremely difficult to scale back. All this is a hefty price to pay for a system that even now is struggling to deal with its caseload. Pennsylvania doesn't need another unfunded mandate, but the flexibility to care for our own in a manner that makes sense both effectively and financially. We need a plan to lower costs, decrease the welfare burden, and make employment the focus. Is it possible to do this with expansion? The jury's not in yet. We have many conflicting estimates of cost, how many numbers will be expanded as a part of Medicaid expansion, and we have no guarantee from Washington, D.C. with maximum flexibility or cost containment, and this continues to be a serious problem. I applaud the governor for going slowly, being very, very studious about this issue. The impact is not de minimis. It's in the billions of dollars, and it impacts many, many people through the Commonwealth. And it's going to impact our budget in many other ways. Experts from the government and healthcare policy groups, physicians, federal and state lawmakers, and other testifiers last week in our committee warned against moving forward with a Medicaid expansion. The committee heard some grave concerns about the Pennsylvania's possible expansion of Medicaid and what it would mean for our state. Testifier after testifier spoke of states having larger numbers of people enrolling in the program than first estimated, and states most assuredly will face the increasing cost to pay for the expansion in just a few years. Testifiers at the hearing also spoke of a broken system that would lead to able-bodied adults crowding out individuals truly in need, such as children, senior citizens, and those with disabilities when it comes to health care services. York County physician and Harvard Medical alum, Dr. Lynn Jensen, based his comments on his 35 years working in healthcare industry when he said Medicaid is a failed system that needs to be reformed, not expanded. It assures neither access to care nor quality of health care, and yet it is fiscally burdensome, with an annual price tag of about $500 billion nationally. John Northrup of the Heartland Institute said states have received false promises of flexibility and control over Medicaid expansion. Due to the restrictions of the federal health care law, true flexibility does not exist. Additionally, major changes to the Medicaid system must first be fully approved by the federal government. Pennsylvania will not have control over its own Medicaid system, despite having to pay for an increasingly overburdened system. He went on to say, declining to expand an already financially stretched and struggling Medicaid system is far more responsible than expanding it based on insufficient information and promises from the federal government. He said expansion would financially burden the state and crowd out essential spending, further limit Medicaid's patients' access to health care, and take even more of the decisions over health care out of the hands of patients and give them to the federal government. According to a new study from the Kaiser Commission on Medicaid and the uninsured, the loosened eligibility for Medicaid under the Affordable Care Act, aka Obamacare, will cost in the neighborhood of $1 trillion over the next decade. For the past several years, the federal government has been borrowing 40 cents out of every dollar it spends. That's like adding $400 of credit card debt for every $1,000 you spend. It will cost a lot of taxpayer money. So where is the new money coming from to expand Medicaid coverage to a projected 17 million people across the country? Like a spendthrift who refuses to mend his ways, the current administration in Washington wants to go on spending money it doesn't have, if necessary, taking out new credit cards to pay off the debt. We should take heed with history. The same tactic that has brought Greece and several other European nations to the brink of bankruptcy. As it was originally written, the Affordable Care Act would have required each of the states to comply with the planned expansion of Medicaid or face a loss of federal matching funds. The Supreme Court struck that down in their decision, saying that you can't force states, you cannot coerce states, force them into the Medicaid program. In fact, Chief Justice Roberts, in opining his decision, said the financial inducement Congress has chosen is much more than relatively mild encouragement. It's a gun to the head. Medicaid should be reformed, not expanded at this time. Medicaid costs have been the fastest growing part of state budgets for more than a decade. Despite the increased outlays, complaints are growing on the parts of patients and doctors. Poor patients often have a hard time finding doctors, and doctors say they have little incentive to stay in the program because of reduced reimbursement rates and administrative headaches. Joe Pitts, in his opinion, gave us a lot of information at the hearing. He said, at last report, 23 states and the District of Columbia are moving forward with an expansion at this time. 20 states have decided not to expand, and 7, including Pennsylvania, are still thinking about it. All of us agree, I think, that our goal is to help Pennsylvania families access affordable, reliable health insurance that works for them. Medicaid is already in deep trouble, and Congressman Pitts made it very, very clear. He wanted to make 2 points, and he drove them home. He said Medicaid is already in deep trouble, and expanding it is going to make those problems even worse. Second, when someone who is already $17 trillion in debt promises to pay 90% of hugely expensive new program, you should be very, very skeptical. When the inevitable happens, the General Assembly will be left holding the bag. When the inevitable happens, it is Pennsylvania's low-income families who will be hurt the most. Neither the states nor the federal government can afford to keep the health care promises we've already made, he said, let alone the new ones that have been made in the Affordable Care Act. Until we fix these problems, he went on to say, we should not be expanding Medicaid. He went on to say, I quote, I warn you to consider the costs associated with expansion, such as administrative costs, and those associated with new Medicaid beneficiaries who were heretofore previously eligible but hadn't enrolled in the state. It's been estimated that to expand Medicaid through DPW, it could take up to 2,000 more state employees just to administer the program. He went on to say, I urge you to be careful. There's no way the federal government can keep these promises. We can't afford the entitlement promises we made before the ACA, and we can't afford this either. We are $17 trillion in debt. Our credit rating has been downgraded, and we have no politically viable plan to pay down the debt and keep our promises. Congress will not keep its promises to you, he went on to say. We broke our promise on special education. We promised in '75 to pay 40%. We actually now pay 17%. We broke our promise to pay for a program for people with pre-existing conditions. Pennsylvania Fair Care was set up under ACA to help people with pre-existing conditions, provisions of the law that take effect in 2014. In February, in Pennsylvania, we had to close the program to new patients because the current administration in Washington wasn't going to fund it anymore. A few months later, the administration announced it would set a ceiling on program payments. The states could either pay the overages or turn their programs over to Washington. Commissioner Considine has announced that Pennsylvania is ceding control in its program to the federal government. To be clear, the ACA promised to help every Pennsylvania with a pre-existing condition. The ACA was going to pay for it. It did for a while, but then pulled the plug. I have a letter from our congressional delegation urging us to be very, very cautious and careful. I will not read it in its entirety, but the underlying theme is what I've already said. It's signed by Congressman Marino, Congressman Ruffus, and Congressman Joe Pitts. They had one day to get signatures and before the press conference, and I do have that available if anyone wants to see that. Ladies and gentlemen, we have just short of $28 billion that is currently a part of the Department of Public Welfare budget overall. That's almost as much as our entire state budget general fund. If we add billions more to this, how are we going to pay for it? If we don't have guarantees, if we do not have the reliability from Washington, if we do not have the history that we can count on, not to be saddled with residual exponential costs to the Commonwealth and its taxpayers, I'm very concerned about how this is going to crowd out other programs in Pennsylvania. Where are we going to find the money? Most of the testifiers said you're facing a massive tax increase, possibly in a few years, possibly longer. We must approach this very cautiously. I have lots of other information, but I'm getting signals that I need to close. So I am going to do that and turn it over to my good colleague, Representative Gidrich.